We are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and
Mr.
I need to fire some of those people to make sure this doesn't happen again. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
So today we saw a Senate hearing involving HHS Secretary Robert F. Kennedy Jr. And you know exactly what that means. It's a performative opportunity for Democrats to get out there and just scream a bunch of nonsense. But their new line of nonsense is frankly quite interesting because from nowhere they've now invented this narrative, it's a desperate one at that RFK Jr. is trying to ban vaccines. He wants to take vaccines away from people. To which I say, I have no idea where this came from. The political stance was never that we're against all vaccines or we want to get rid of them. We don't want to allow people to have them. It was always that people should be able to have an informed choice on all types of medications. And by the way, things in general, right? Food and water, etc., that you are putting into your body. Right? In order for that choice, of course, to be, first of all, informed, it has to be based on good information, which means we have to have solid science behind it, and we need to allow people to know all sides of the scientific argument. And secondly, they ought to be allowed to have the choice, right? It was always mandates that were being opposed here, but of course, this is a narrative that's being invented. Why? Because they are trying to muddy the waters of the greater effort that RFK is doing, which is to genuinely challenge the food and pharmaceutical monopoly in this country. And of course, the great irony I'm about to point out, because many different Democrats will get out there and scream a bunch of nonsense, but particularly the two biggest, I don't know if you want to call them hypocrites, I would just say genuinely insincere people on this issue are the progressive senators, Bernie Sanders and Elizabeth Warren, who both for years have said that they're against big pharma, they're anti-establishment, they're fighting the system. And yet I knew from the moment that Bernie Sanders voted to not confirm RFK Jr. that they were never serious about this, right? The moment that it actually comes push to shove, the moment that you have someone who's actually challenging the pharmaceutical monopoly on this country, Bernie Sanders says, no, that's a threat. He takes the side of big pharma, which is very interesting because I think this follows a long pattern of Bernie Sanders' style of thought, which is that he'll performatively challenge the establishment. He can always stand there, not being in power, not being the president, and say the establishment is bad. But then when someone like certain people in the Trump administration actually come along and do something against the establishment, whether that's Tulsi, whether it's RFK Jr., people Bernie in the past seems like he should have been able to support. What does he say? No, the establishment is right and you are wrong. And this, of course, is coming at the same time where Bernie is writing entire op-eds about how Kennedy must resign because he's against the vaccines and he's taking away vaccines, which again is not even true. So they're basically inventing a fake narrative, again, to confuse people from the actual good work here that's being done. So we'll tell you all about it. We'll react to some of this nonsense in today's video, and you can get a picture of how this went. So that said, guys, do us a favor. If you enjoy our content, make sure you hit that like button down below and subscribe to the channel if you are new. Subscribing is not only the best way to support our videos, but it also ensures that you can stay up to date with all of the latest news and coverage. And that said, to give you an example of how, as I said, this narrative is completely made up, here is just one example of what you saw here today. Actually, ironically, from a Rhino senator, right? From a Republican senator joining in here. It's like the Uniparty versus RFK on this COVID vaccine issue, where they're, again, completely making stuff up. Take a listen.
Economy's an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also...
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when as an attorney you attempted to restrict access.
Yeah, so that basically gives you an idea of how all of these congressional hearings go. Hey, why did you say or why do you believe X, Y, and Z? Wait, but I don't say or believe X, Y, or Z. Okay, anyways, let's move on to the next question. Why are you Hitler? That's how all this stuff goes. But anyways, that said, kind of continuing this theme where whatever, okay, so you have rhino Republicans, you have establishment Democrats. I want to hone in here specifically on the people who claim that they're anti-establishment. They reiterate they're not bought out or owned by the pharmaceutical industry or the food industry or any other lobbies, which, most of DC obviously is. And that, of course, pertains particularly to Bernie Sanders and Elizabeth Warren, who, of course, have somehow at the same time been the biggest opposers of what RFK is doing. And they haven't given him a hint of credit, even if you want to disagree on some of the stuff relating to, vaccine recommendations and all that. Hey, how about the fact that RFK got the real sugar back into Coca-Cola? How about the fact that the synthetic food dyes are being banned in almost all of the major food companies across America? No. Let's not even talk about that because, of course, we care more about performatively being anti-Trump and actually implicitly defending the food and pharmaceutical establishment than we do, of course, actually standing by the very principles we claim to espouse. And that's exactly what you saw here when Elizabeth Warren tries to, first of all, reiterate this notion that we're banning vaccines or something, which, again, we are not. I don't know where this even came from. And going on here as RFK Jr. is about to call her out for being a stooge, yes, of the very pharmaceutical industry that she claims with her Medicare for all and all this garbage lowering drug prices, she actually opposes. But as you can see, the controlled opposition here is real. Every time these so-called populist left, anti-establishment left-wing actors, take a moral stand, in the end, they always end up supporting the establishment, and it always goes this way. Champagne socialism, I guess, in a sense. All right, check it out.
Let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying...
And by the way, this is already a misrepresentation of the position. So they changed the recommendations for, I believe it's like teenagers and especially male teenagers in terms of, does the CDC recommend this or do they say you need this versus, but it doesn't say you can't take it, right? Again, that's the whole thing. It's the whole argument here surrounds informed choice. It has nothing to do with, banning it or saying you can't have it. So they keep on arguing something that is not happening, right? It's just not happening.
That is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big...
Good point. So if you didn't hear it there, right? RFK pointed out, you've taken $855,000 from the pharmaceutical industry, Senator. Why is that a pertinent point? Because Elizabeth Warren's line of argument here is ridiculous, okay? We have a private healthcare system in America. I know these people are against that, but, that's what it is, okay? And her argument is that, well, if the insurance companies, or it's no longer going to basically be free because of the recommendation, they're going to have to pay for it, then you're taking it away from people. But that's, of course, not true, right? For instance, okay, let's pick something non-medical. Let's say a coffee machine. So let's say there's a government program that says, oh, we want every American to be caffeinated, so free coffee machines for everyone. And then they terminate that program and say, no, you go buy your own coffee machine. Is that taking away my right or my ability to have a coffee machine? No. It's just simply saying, okay, the government might not give it out for free, or the insurance companies might not give it out for free, which, by the way, in the context of healthcare, happens a lot. Okay, it's a real thing a lot of times that crooked insurance companies will deny you coverage for something that you do legitimately need, right? You might have like a chronic illness or something, and they say, we're not going to pay for the medicine or only partially, right? Diabetics sometimes have this problem when it comes to insulin, all that stuff, right? So, yeah, I mean, you could make the argument that, oh, this system needs to be fixed or reformed in some way, but to say that, oh, you're taking it away simply because you have to pay for it is ridiculous. It doesn't even make any freaking sense, okay? But of course, what is going on there? Why is she mad? Because who gets paid, of course, when insurance companies or the government subsidizes medication, gives it out for free to people? Who are they giving the money to make it free? The very pharmaceutical companies that Elizabeth Warren takes $855,000 from, see? So that point, obviously already you hear it and it's like, yeah, she claims she's like anti-establishment, anti-money in politics, but she's very corrupt. That's true. But also on top of that, the question as to why is she so mad that they're not taking away a form of a medical treatment, you just have to pay for it. Well, there's your answer. Because the pharmaceutical companies are getting bankrolled by either the private insurance companies or the government, whoever's subsidizing it, to give these vaccines out. So there you go.
Sign saying that you were lying when you said that, because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not.
Again, it's such a ridiculous application of language. It's factually untrue that to make something cost money is taking it away. Okay. We don't live in a communist society. I know, Elizabeth, you really wish that were the case, but if something is available to purchase on the private market, by definition, it is not taken away. It is not banned. That's how the world works. Our world works, at least. Okay. So you cannot selectively pick this issue and say you're taking away. And again, I understand. Okay. She really wants a communist society. I understand that, but that's not accurate.
Taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that.
You won't even let him respond. See, that's, as I said, how these congressional hearings go. Why are you Hitler? Well, I'm not Hitler. Hey, don't talk over me. Yeah.
When people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused.
Again, that's an important point, by the way. Okay, Medicare and Medicaid will still pay for them. So her only argument is that private insurance might not still cover it. Maybe, who knows, right? But that's how private insurance works. Like private insurance sometimes denies coverage and then they give coverage. Where's the vaccine being taken away? Simply because, oh, you might have to pay out of pocket. Yeah, that happens with private insurance all the freaking time. So what's the issue here? There is no issue. She's making it up.
To sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
So, as usual, the point of congressional hearings is supposed to be to actually ask real questions, to get information so that lawmakers can make choices, et cetera, et cetera. I mean, we've all learned that video in school or whatever about how this is supposed to happen, but you can see this is the reality of it, right? Let's just performatively scream. We have learned nothing. Elizabeth Warren has made a fool out of herself. She just basically, again, put a bunch of words and fake positions into RFK's mouth and then got really mad when RFK responded. So there you have it. Of course, we also have Bernie Sanders, who is going to go on the same route. And he's still pretending like he's this anti-establishment warrior or whatever, right? He says, when you ran for president, we have a corrupt campaign system. Maybe you'll agree with me on that. But, it basically tries to make the accusation here implicitly, Bernie does, that the pharmaceutical companies are not the ones backing Elizabeth Warren and Bernie Sanders, but actually RFK Jr., and it doesn't go that well. So check this out as well.
Okay, you were already president, you got $1 billion behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
No, I'm saying...
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people... is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few.
Yeah, so basically, when Bernie calls out the pharmaceutical industry, that's good. He's a real warrior. He's the best Democrat. He's amazing, all this stuff. But when RFK does that and then actually tries to take action, no, you can't steal my thing. You can't actually do something to fix the problem, because then what else would Bernie Sanders cry about, right? That's all he's good for, by the way. Has he ever done anything meaningful? Would he, even if he was the president, actually accomplish any of the things he always promises? No, obviously not. His job is just to moan and complain, like he's basically done his entire life, right? Never built anything, just complained about a lot of things. And that's what's going on. And that is the source of a lot of this like progressive opposition to the more populist, formerly left-wing people in Trump's administration, like RFK or like Tulsi. That's what is surrounding a lot of it, is the jealousy that, hey, we're never going to be in those positions of power, first of all. But then secondly, you can't fix the systemic problems because, yeah, of course, what would we grift about, right? Right? So there you go. Of course, as you could expect, the thing just gets more and more ridiculous because this Democrat senator right here apparently asked RFK Jr. about the Epstein situation. To which I say, what does that have to do with HHS? Like, isn't this supposed to be a hearing about how that agency is performing? And aren't supposedly the congressmen supposed to be learning relevant information to inform their decisions? No. Let's just have a political stunt about the Epstein press conference yesterday, as if that has anything to do with RFK Jr. So take a listen.
We're the ones who delivered it. So I'm just asking, yes or no, do you want to do something about this? Yes or no?
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were
Do you think they were perpetrating a hoax yesterday?
perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health. So you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease. But you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives. And you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you, Senator Warren.
But of course, I mean, we all know the Democrats believe at this point that everything the Trump administration does, as Chuck Schumer said about the crime issue, must be a distraction from Epstein. So trying to fight crime is a distraction from Epstein. Trying to solve the chronic disease epidemic, apparently, is a distraction from Epstein. Actually taking steps to lower insurance premiums, which the Democrats, when they had power and did Obamacare, raised on the vast majority of Americans, that's a distraction from Epstein. Okay, everything's a distraction from Epstein, okay. But anyways, guys, with that said, you basically get the picture. Totally just performative garbage as usual, and totally disingenuous, insincere, progressive screeching, especially from Warren and Bernie Sanders. And what else is new? Can we just stop doing these hearings altogether, frankly? Okay, they're a total waste of time. Think about how many taxpayer dollars it costs to have stuff where they just scream at each other like this, right? Nothing is accomplished. There's no point. It's all just performative theater. It's all just so each senator is fighting to get their hit moment so they can go on MSNBC that night and talk about how, oh, I'm so amazing. Please donate to my campaign, right? It's just garbage. It's garbage. But anyways, with that said, let me know your thoughts on this in the comment section down below. Be sure to leave a like on this video, subscribe to the channel if you are new. And until next time, God bless and peace.